You're good to go, Mayor.
All right. Good evening. Welcome to the City Council, Norman Utilities Authority, Norman Municipal Authority, and Norman Tax Increment Finance Authority special session meeting of May 18th, 2021. Madam Clerk, will you please call the roll?
Councilmember Studley. Councilmember Schuler.
Here.
One moment, I need to move Allison over to the panelist side. And she is here. Councilmember Hall.
Here.
Councilmember Nash.
Here.
Councilmember Foreman.
Here.
Councilmember Holman.
Here.
Councilmember Peacock.
Here.
Mayor Clark.
Here. All right. If it's all right with all of you, I would like to hear from Dr. Bratzler now. So he has to get back to work and do the good things that he does. All right. Madam Clerk, is there any issue with that?
No, you might want to read the item.
Okay, the item under consideration is adoption, rejection, amendment, and/or postponement of ordinance 2021-49 upon first, second, and final reading. An ordinance of the Council of the City of Norman, repealing Article 11, COVID-19 pandemic of Chapter 10 of the Code of the City of Norman and eliminating a reference to the same in Section 15-506 of the Code of the City of Norman, declaring an emergency and providing for the severability thereof. So, Dr. Bratzler, I think you know what we're talking about tonight. After the CDC recommendations, there have been a lot of questions about the city's mask ordinance. And it's my understanding that Norman is the last one in the state of Oklahoma to have a mask mandate in place. So I think we're looking to you for medical guidance as we've done this entire time. So we look forward to hearing your input.
Yeah. Thank you, Mayor Clark. So I'll try to keep my comments relatively brief. As you know, CDC last Thursday put out new guidance that people who are fully vaccinated can gather indoors, outdoors without a mask. And that was based on science and a variety of studies that have shown that people who are fully vaccinated have very low rates of getting infected with COVID-19. It's not zero, but the rates are quite low. And there are also good evidence now that fully vaccinated people prevent asymptomatic infection, which means you can stop the spread of the disease. Again, the CDC guidance applied to fully vaccinated people, which is part of the challenge. And there have been many medical editorials this week that have been critical of that guidance because we know that about 2/3 of Oklahomans still aren't fully vaccinated. So there are a lot of people that aren't vaccinated. And the other two exceptions were healthcare settings, obviously still require masks. And then federal transportation guidelines explicitly require masks when you're in a plane, train, or a bus. And those are federal guidelines that are a part of an executive order that did not change with the CDC guidance. So that's the background. The good news is that in Oklahoma, we couldn't be positioned better for a policy change like that currently where we're at right now. So in Oklahoma, as of this morning, we're down to 3 cases per 100,000 population per day for the entire state. Now, remember last January, we were 103 new cases per 100,000 per day. So we've had this precipitous drop in the number of new cases daily. On average, Oklahoma, the entire state, sees only 136 new cases a day right now. And I looked at Norman data. The health department only updates it weekly, but through last Wednesday, Norman was seeing on average 7 new cases per day from COVID-19. We were down in the state down to 111 people in the hospital, which is the lowest we've been in a very, very, very long time. The other point I would make about cases is the health department, they reported that they feel that there are about 1,200 active cases in the state. And I always assume that that number underestimates the true number of people who may be infected but simply didn't go get a test. So I always multiply that number by 4 or 5. But it's quite conceivable that in the entire state right now, out of a population of almost 4 million people, there are only 5,000, maybe 6,000 people in the state that are actually infected. So your chance of running into somebody that's actively infected with COVID-19 is not zero, but it's dropped very, very considerably. So that's where the state is right now with respect to number of cases and the risk of infection. There are two caveats to that data I want to make you aware of. The first, we know now from a number of studies that people who are immunosuppressed, take cancer patients on chemotherapy, particularly blood malignancies and lymphoma, patients who have had organ transplants, who often take substantial immunosuppression, people who are on immunosuppressive therapy for rheumatoid arthritis, systemic lupus, even when they're fully vaccinated, multiple studies now have shown that they don't get nearly as good of an antibody response to the vaccines as somebody who is healthy. So I think it's important to remember that there will be people in your community who, through no fault of their own, who may be fully vaccinated, but will still be at risk of the complications of COVID-19. That's the first caveat. The second one is, I think many of you are aware that variants have been circulating in the state, and the one that has us most concerned at the moment is the India variant, B.1.617.2. There have been 17 cases reported in the state, 13 of them in Cleveland County. There was a cluster in Cleveland County of 13 cases of the India variant. And of the 17, I don't know about those in Cleveland County, but of the 17, 3 were fully vaccinated, 2 had had 1 shot of either Pfizer or Moderna. So 5 of them had at least partial vaccination, 3 of them full vaccination. So that's a bit concerning. None of them required hospitalization. They were all symptomatic. That's why they went and got a test done, but none of them required hospitalization or had any major complications. But that is in the background, that there are cases of the India variant virus that are in Oklahoma now. So now let me shift to what we're doing at the University of Oklahoma, which we recognize the university population has a big impact on the Norman community. And of course, most of our students are going home now for the summer, so we'll be less impact, at least through the summer months. But after reviewing, and quite honestly, after the announcement by OSU that they eliminated all masking requirements, and they eliminated all social distancing in all of their facilities and all of their activities, we feel somewhat forced our hand to have to look very carefully at our policy. I can't tell you the exact day that it will come out, but there's going to be a substantial revision of policy for the University of Oklahoma to strongly recommend masks for anybody who is unvaccinated. We know anybody under the age of 12 that comes in for a summer camp, they cannot be vaccinated at this point. So we'll still recommend masking for those individuals. And we will be reducing the social distancing requirements. That actually takes quite a bit of time because it means moving chairs, seats, and other things at the university. So that will take some time to implement. But we will be announcing in the very near future substantial revisions to our mitigation strategies on the Norman campus, all 3 of our campuses, in fact, that will have no impact on our health services because our health services will require all of the continued mitigation. But for the Norman campus in particular, we will be eliminating the mask requirement for anybody. We'll be strongly recommending it for fully vaccinated, but it will be on the honor system for people to wear their mask. And I think that's where most communities find themselves, and businesses at this point, that it's a bit on the honor system. The good news is if you're fully vaccinated, you should be fairly safe. Not to say breakthrough infection never occurs, but it occurs uncommonly.
I think I'll clarify that the University of Oklahoma Norman campus has all virtual summer classes. So we'll have less of a student population than normal this summer. So wanted to mention that as well. Thank you, Dr. Bratzler, for that update in terms of what the recommendations were, the current status, and the caveats. I think we need to understand all of that. And obviously, it's very helpful to know what OU is doing, considering I've deeply valued the partnership that we've had and having similar policies along the way. Are there any?
Well, honestly, I'll just tell you, Mayor Clark, that we actually have delayed our announcement of any changes, particularly because we knew you were having this meeting.
Thank you. Well, and I'm glad that the meeting was after 4 days of graduation, where thousands of people were visiting our community from around the nation. So again, I appreciate the collaboration and partnership that we've had throughout this crisis. Councilmember Holman.
Thank you. I don't really have any questions. I just wanted to also extend a thank you to Dr. Bratzler for all the advice that you've given the council throughout this last year on this issue. And I have often told people that all of our decisions at City Hall and that Mayor Clark has made in response to COVID have been based off of your advice and Dr. Cook at Norman Regional and Dr. Raskob, and that it's all been based on our local medical professionals. So I just really appreciate you taking the time to come on with us again and give us another update. Thank you.
Thank you.
It's my pleasure.
Councilmember Hall.
Yes, I also wanted to say thank you to Dr. Bratzler and all of the input that you've had all year. It's really been a collaborative partnership between the university and the city of Norman and the Norman Public Schools to try to get this right, to protect our community. One thing I did want to ask you is what is the vaccination rate with the OU student population or student and faculty population? Do you know?
Yeah, that's a great question and one I can't answer easily. So on the Health Sciences Center, I know all the numbers, and I believe on the Health Sciences Center, we've achieved herd immunity truly, because we have numbers that are in the 80 to 90% range for most of our populations. On the Norman campus, I don't know. We're currently doing a survey of student, staff, and faculty to try to get a sense, and we're hoping to start capturing it, just like a college student has to declare whether they've had meningococcal vaccine or MMR or some of the other vaccines. We're going to try to capture that when they come back to campus. We will be offering vaccine clinic on move-in day on campus. So we're going to do everything we possibly can to encourage students to be vaccinated. There won't be any student requirement except for students that take care of patients. They will have a requirement to be vaccinated.
Well, congratulations on such a high success rate on the Health Sciences Center campus. That's really promising to hear that we have that high of a percentage in that particular population. The other thing I wanted you to just comment on, or any advice that you have, it seems that since the CDC came out with this new set of recommendations, that we find ourselves in a transition. And as you mentioned, we have the immunocompromised that are still going to be at risk. We have children under the age of 12 that don't have a choice quite yet about whether they can be vaccinated or not, which puts parents in an interesting position. But it seems to me that we've had a lot of success with supply of vaccine in Oklahoma and availability of ease of availability for anybody who wants to be vaccinated. And we find ourselves at a place where we've probably successfully vaccinated everyone who chooses to do so. And I'm just wondering if you have any suggestions for any kinds of shifts in strategy as we go forward to continue to obviously provide access to the vaccinations, but how can we reach those populations that are still hesitant about receiving vaccines?
Yeah, so it's a great question. I'm actually not convinced that we've reached everybody that will take the vaccine. There is hesitancy for sure. But for instance, I'm going to be seeing patients tonight. I see a big population of uncontrolled diabetics. And when I sat down and explained their risk of the complications of COVID, I can almost always very easily convince them that they need to get the COVID vaccine. So I think part of the strategy is getting it to the patients where they're at. Our strategy at OU has changed completely from big clinics to small, what we're calling micro clinics that we take out into churches and communities of color, places where people go, just trying to find opportunities to give vaccine to people who, it's not that they don't want it, they just don't want to go online and sign up. They don't want to, have to go stand in line somewhere or go to the fairgrounds or those types of things. So it's changed our strategy considerably. But right now, if you look at Oklahoma, about just under half the population has had at least one dose. One dose of the Pfizer Moderna vaccine give you about 80% protection. We don't know for how long, but they're pretty effective. 2 doses, obviously much higher, but only about 38% of Oklahomans have had what we consider fully vaccinated at this point. I look at Cleveland County numbers. I think Cleveland County is a little bit higher than the state average. I think you're around 40.2% are fully vaccinated. There are some rural counties that still have very low rates.
We do have Jackie Knack from the health department here. I'm just saving her. We got to get Dr. Bratzler in and out. So thank you, Jackie, for hanging around with us and save those county specific questions for her.
Okay.
Councilmember Patron. Oh, or sorry, Councilmember Hall, are you done?
I was just going to say thank you to Dr. Bratzler. And, in the city of Norman, we've also tried to do smaller micro events to reach populations that, may have challenges. So thank you so much.
We hit some churches, we hit some neighborhoods. We just did one at Adams Elementary for the 12 to 15-year-olds, and we'll do another one at our Movie in the Park series. I think we're looking at June 11th, not confirmed yet. So we're going to continue. I like that strategy of the micro clinics versus the mega pods. So the needs have changed, and we can continue working on that.
Yeah.
Councilmember Patron.
There we go. First of all, I want to start by saying that I'm so incredibly grateful for you all as well. I mean, this last year, I can't imagine having to try to make some of these decisions without your expert counsel, and I'm just really, really appreciative for you. One question about the India variant. You expressed that we know that some of them were vaccinated. Can you tell us which vaccine they took?
So the reports, and Jackie may know more than I do, the reports I saw said Moderna from the state health department. The studies I've seen, there are very few studies out there, but there are studies that have taken serum from vaccinated people and serum from people who previously had COVID and applied it against the virus, and have shown that the vaccines appear to be partially protective, but not as protective as you would like. So the virus is about 6 to 7 times more likely to evade antibodies from the serum of people who've been fully vaccinated. That said, it does give you some protection. So what we've seen in the state, and one of the points I want to make is we've seen the UK variant spread across the entire state. It is the predominant variant in the state, although in the UK, where the UK variant started, the India variant is now becoming the predominant variant in UK because it spreads incredibly effectively from person to person. So the India variant may become the predominant strain. Despite the fact that we've had these variants in Oklahoma, Oklahoma's down to 3 cases per 100,000 population per day. We're getting down to the numbers where, we had talked about the possibility of eliminating many of the mitigation strategies once we got down to 1 to 2. So Oklahoma is the lowest state in the nation right now in terms of number of new cases per day. My honest opinion at this point is that we will do reasonably well through the summer.
That's wonderful.
We won't see a lot of outbreaks. We'll see periodic, small outbreaks, clusters, things like that. What I really worry about is the fall and winter. So take the elementary kids. If we don't have vaccine for kids below the age of 12, when we start bringing them all together into the classroom, again, they typically don't get nearly as sick, but they can spread it to other people, the virus. So, I think that's my big concern. Is this virus going to behave like other seasonal respiratory viruses that will peak in the fall and winter. And I think we're going to have to be very cautious and watch what happens when we get all the students back together and things like that.
On that note, do we know if they're working on a booster for the India variant for vaccinated people?
I can't tell you which variants they're putting, but I know Moderna and Pfizer are both already looking at reformulated versions of the vaccine. There's no clear evidence at this point that you'll need a booster because we don't know how long immunity will last. But they're already testing new formulations of the RNA vaccines with variant RNA in them.
That's good news. You spoke about kids 12 to 16. Well, I guess this is a two-part question, but and it may be for the count for Ms. Canuck as well. I'm not sure, but the first part would be that you spoke to maybe Cleveland County having around 40.2% vaccinated. Is that of people who are eligible for the vaccine, or does that include kids who are ineligible at this moment?
Yeah, Jackie probably can give you a better answer there than I can. I looked at that map today and it was 40.2%. I can't remember whether that was 16 and over. I think it was 16 and over, but it's about 40% are fully vaccinated.
She's nodding yes, so that sounds good. Okay, and that's encouraging as well. That it, of course, we want to get those numbers up, but ultimately it's their choice. So I guess. And then for the 12 to 16-year-old, as a medical professional, I have a 12-year-old daughter, and assuming that she's healthy with no immune compromising situations, all things being equal, would you recommend the COVID vaccine for ages 12 to 16? And maybe that's for Dr. Cook. I see her down there.
If I can, okay, so I'm a mom
Type of question.
and a pediatrician, and I got my son vaccinated through the Moderna trial before the, Pfizer was open to 12 to 16. So yes, absolutely, I would recommend it, and I did it for my own kid.
Thank you, Dr. Cook. I just wanted to give you all an opportunity to speak to that point. And then international travel. I don't think we covered that. So we are going into the summer. Coming back into the US, I know every country is going to have different rules as far as quarantine or whether or not they're, it's even open for travel. But with respect to the US and maybe the university, do we have any idea about how we're going to be handling, is it depending on where they have been, if it's a area that has a large community spread at that time?
Yeah, so that one's really clear. So that I didn't mention it, but in our policy of required vaccination, it includes all students that have any patient exposure. All students doing study abroad, any international travel have to be vaccinated, including faculty that are going to do anything as a part of their employment with the university. And then the other group is students that want to come and shadow in any of our clinical settings where they could be exposed to patients, then we will require them to be vaccinated. So those are the three populations. For international students that return to Norman, if they're not vaccinated, they will automatically go into quarantine and will have testing done, which is required right now by federal executive order that they have to go into quarantine. If they come in and they are fully vaccinated with one of the WHO approved vaccines, there are a couple that WHO approves that aren't available in the United States. We're not going to revaccinate them. But if they come in and they've been fully vaccinated with one of the World Health Organization approved vaccines, then they won't have to quarantine.
Okay.
We will be testing them routinely 3 to 5 days after arrival.
Well, I think that's all the questions that I have. Again, thank you so much, each of you. I'm just really, really grateful for you.
Thank you. I know this might be a little early. I know I'm prepared to walk back anything we do tonight if we see massive spikes in the fall.
Absolutely.
And I'm sure OU is as well.
Absolutely. We watch it every single day. And I usually send my stuff to Mayor Clark whenever I have a chance. So.
Okay. All right. Any other questions for Dr. Bratzler before he gets back to work? All right, not seeing any. Dr. Bratzler, I want to share my appreciation as well. You've been amazing and have not hesitated to guide us and help us make data-driven decisions throughout this pandemic. And we, as you can tell, all are incredibly grateful for your time and expertise.
Yeah, thank you very much. And I want to point out that the actions you took actually had a profound impact in Norman. One of the things, I've shared this with Mayor Clark several times, but when I look at Norman community within the greater Cleveland County, your rates drop substantially more than the rest of Cleveland County once you put those restrictions into place. So it clearly made a difference. Fewer cases were diagnosed after those went into place. So I have good data. And in fact, Mayor Clark doesn't know, but I'm looking at writing an article that kind of highlights the whole impact of a university on a city, but also how restrictions made a difference. So appreciate what you guys did too.
Thank you, Dr. Bratzler. I appreciate that. Take care. And before I jump back into the technical language of our agenda, I want to thank this council because I've had your support 100% of the time. And I know for a fact that not all mayors have been as fortunate to have the support that we needed to make some very difficult decisions. So my appreciation goes out to each and every one of you as well. Okay, back to the official part of the voting, and then we'll get back to Dr. Cook and Ms. Knack, who are here with us to answer additional questions. Dr. Cook, to clarify, is also with the Norman Public Schools Health Task Force, so we can, it's probably got a cooler title than that, but she can speak to that as well as being the one of the head pediatricians at Norman Regional. And Jackie Knack's obviously in charge of Cleveland County and District 6, which is actually bigger than that. So I will now entertain a motion to adopt or reject the ordinance on first reading by title only.
So moved.
Second.
Thank you. The motion on the floor is to adopt the ordinance on first reading by title only. Madam Clerk, will you please call the roll?
Councilmember Studley,
Aye.
Councilmember Schuler,
Aye.
Councilmember Petrone,
Aye.
Councilmember Hall,
Aye.
Councilmember Nash,
Aye.
Councilmember Foreman,
Aye.
Councilmember Holman,
Yes.
Councilmember Peacock,
Yes.
Mayor Clark.
Yes,
The vote passes unanimously.
thank you. I'll now entertain a motion to adopt or reject the ordinance on second reading, section by section.
So moved.
Second.
Thank you. Before we vote, I'd like to recognize Catherine Walker, our city attorney, to give us kind of an overview and to make some brief comments.
Thank you. So this ordinance, of course, was adopted last July, almost a year ago. Kind of amazing looking back, but it requires masks. The ordinance as adopted back then required masks in certain places. Most places where we thought we'd see gatherings of people, public service areas, places of public accommodation, and then public settings where you couldn't maintain social distancing. Of course, there were exceptions to that, and we also limited the capacity in restaurant and bars to ensure social distancing between groups and to ensure that the standing areas only were closed to try and avoid crowding. With this ordinance, we would essentially be repealing all of that. It can be adopted again later if it had to be, but at this time, with the direction from the CDC and the low numbers that we're seeing, it seems like an appropriate time to consider repealing it. Right now, as adopted, it has a sunset date of June 1st. So this is just moving that up 13 days by my count. But it does, it is in response to the CDC guidance and the low numbers we're seeing continuingly week after week. I'm happy to answer.
Thank you, Ms. Walker. You and I have been speaking about the difference between this proclamation and the state of emergency, which I have the authority to declare through our city charter, and they are separate, correct?
Yes, this ordinance and the proclamation are separate. I do think we'll have a proclamation coming out that will continue that state of emergency. We've been talking through that to ensure that adolescents 12 to 16 or 12 to 15 have the opportunity to be fully vaccinated. But this ordinance will repeal the mask requirements and the capacity limitations.
So to clarify that one more time, everyone understands they're two different things. And after our discussion, I suggested that we do not reduce the state of emergency until everyone that is able to get vaccinated has a chance to be fully vaccinated, not just have access to it. So
That's right. And as Dr. Bratzler said, the CDC defines that as 2 weeks post your full series of vaccines. So we know that the CDC recommended the vaccine, the Pfizer vaccine for adolescents on Wednesday last week. I was on the Walgreens app trying to schedule an appointment Wednesday night, got one for Friday, but that was also when we had the first clinic for adolescents in Norman. And so we know that 2 weeks past that date, June 18th, is the date that kids first had the opportunity to be fully vaccinated.
So council, that is where I'm at with the state of emergency. I wanted to make sure you knew that and my thought behind it. And I'm happy to answer any questions about that as well. But any other questions for Ms. Walker explaining what's currently in place and what will happen should we take action tonight? Councilmember Foreman.
So just so that we state it and so that everybody watching knows, if we get rid of it tonight, if we get rid of it, what would we need to do since we're still under a state of emergency? Would we just have another meeting if we see the mask, a need for the masks keep going, et cetera?
The state of emergency is by the mayoral proclamation. So if updates need to be made to that, the mayor's able to make those unilaterally. But of course, if as Dr. Bratzler said, we're probably going to be okay through the summer. But if we see issues coming again in the fall or in the winter, the ordinance is always an option we can come back to.
And can you clarify for those watching that the city of Norman, we repeal it tonight, that private businesses can still require masks? Is that correct?
That's correct. Private businesses can still require that. Regardless of our ordinance, masks will still be required on buses and in public transit or public transportation. That's a federal requirement. I expect hospitals will probably still have some requirements for masks. So all of those things can be done, and that is a business by business decision.
Thank you.
It's like the no shirt, no shoes, no service. So I appreciate that question. Councilmember Hall.
Yeah, that was actually my question too. I've heard from a number of small business owners who were just not certain as to whether or not they could continue to require masks with those that are coming in to their business. And this was, I think I've heard more from hair salons maybe than anybody else. So I appreciate that clarification, because I think in this transition, there are a lot of questions, and I think, the more that we can push out information to what our small businesses are able to do, I think that'd be particularly helpful. I also noticed when Oklahoma City lifted their mask ordinance, they also provided updated templates and PDFs for the signs that were distributed across the city. And I know we provided that service to our local businesses too. So I'd love to see us be able to offer something like that for those businesses that still want to communicate clearly with their customers what they're doing.
That is an excellent point, and hopefully we can reach out and see their wording and model that as well. I look forward to working with the Chamber of Commerce on this. They did a great job communicating to all businesses the requirements, and I hope that they will also communicate the ability to have this requirement in place if businesses so choose. So we will continue to part with them as well.
Okay, thank you.
Councilmember Patron.
Once again, Dr. Cook, I heard with the city buses, obviously the mask mandate will still, the federal one will still be in place should this pass tonight. How does that figure in for NPS, and do you anticipate that NPS will be continuing the masks at school until the adolescents or the 12 to 16 are able to be protected, or do you think that is that a school board question? I'm not sure.
I think it's a school board question. I know they discussed it at the last school board meeting, but I don't know. So definitely they'll continue the mask through the end of the school year just because we have like a week left. But the decisions were about summer school and then in the fall. And I think it's just too soon to say in the fall. I think it would be unlikely that masks are required in the fall, but again, that would be the school board's decision to make. I see a lot of ways to try to encourage vaccination, particularly if we're still having to do quarantines, and for athletes, I think it's a big motivator to get these student athletes vaccinated so that they wouldn't have to quarantine and miss a season. So in looking for more ways to encourage folks to vaccinate, I think, being able to be in like cohorts or pods without masks or to avoid quarantine if vaccinated would be a good motivator.
Dr. Cook, can you clarify that? Because as a parent of an 8th grader, I was unaware of that until I had actually had a conversation with Ms. Knack, and that is a big motivator. So will you clarify that policy once children are fully vaccinated?
Yeah, so consistent with CDC recommendations, if you're fully vaccinated or have had prior infection with COVID-19 and you are a close contact, you're no longer required to quarantine.
So you don't have to stay home with your children for 2 weeks. Is everyone listening to that? Okay, so not just sports, but sanity. Okay, sorry, Councilmember Patron, anything else?
That's it. Thanks.
Councilmember Schuler.
Yeah, I don't have any further questions that haven't already been addressed, but just really wanted to reiterate, thank Catherine for kind of the clarification on what small businesses can do that they can still require masking within their business, their private business. Also the clarification about city buses and transportation, because I think those are really two important clarifications on if we lift this. And then also kind of wanted to reiterate what Councilmember Hall said about getting out messaging to the city and to everyone and working with the Chamber of Commerce on letting people know how this guideline shifts and what's happening. So just wanted to kind of make some emphasis on points that have already been made. So thank you, everyone.
Dr. Cook, when will there be a decision about summer school? Because I've had questions about childcare and other summer camps. And is it CDC recommendations that will control that, or what are you hearing, especially with MPS?
Yeah, I wish I had the insider information for what the board's going to say for summer school. I know we, as a medical cabinet, presented some options as far as, if you're outdoors, we don't need to mask, cohorting classes, especially since there's much smaller class sizes in the summer, to see if there are ways that we can be more flexible with the masks, but still when you're in public areas, still wear masks. So I honestly don't know when the board will make that decision. I'll try to find out while we're on this meeting.
Thank you. Well, it sounds like for those that are running summer camps and childcare, as if you're watching outdoor, definitely no masks, but perhaps indoor would be a safe choice, especially for those under 12 unable to get vaccinated. Okay, any other questions for Ms. Walker? All right, I know that Dr. Cook is doing some research. We've already asked her a few questions. Jackie, it's Knack, right?
Yeah, that's correct. It's Knack.
Okay. All right. It's like, oh my God, I've been saying it wrong this whole time. All right, Jackie Knack. So thank you. You've been phenomenal and amazing through all of this. Can you go ahead and confirm what Dr. Bratzler had said about the Cleveland County's hopefully higher vaccination rate than the rest of the state?
Yes, actually. So as you guys know, the data isn't broken down into cities specifically, but we were able to kind of mess with the numbers as far as population goes per zip code in Norman, and kind of break it down a little bit further than just Cleveland County for you. So the zip codes that my epidemiologist Matt used were 73026, 73069, 73071, and 73072. And of those 4 zip codes, we are just a hair above 40%. So I said 40% fully vaccinated. So that means that everybody's had 2 doses or 1 of Johnson & Johnson and are at least 14 days past that 2nd dose requirement. Now, in these numbers, it does not include anyone in Norman in these zip codes that went to an Indian Health clinic. because we don't have access to those numbers. They use a totally different database. And of course, we know that, there are some Indian health clinics pretty close to us. So they that just means that they could be a little bit higher than what I'm reporting right now, which is great. That also does not include 12 to 15-year-olds, just like Dr. Bratzler said. It's 16 plus, because that's what we had access to. We have access to so far. I can tell you that we had 2 different events, one at Norman North and one at Norman High last Friday. We vaccinated over 450 kids at that time. The majority were 12 to 15-year-olds. And then we had several that were second doses, 16 and over. So we were really excited about that. We had the event on Saturday as well, where we vaccinated about 26 people. And then we have 2 days in Norman, specifically Mondays and Wednesdays, that we have open clinic from 9 to 3:30. People can walk in and be vaccinated. We've had really good uptake with that. Those 2 clinics. And then we still had our Sooner Mall pod this morning, and we vaccinated. We did just a hair over 450 doses this morning. So we're still doing pretty well as far as vaccinating here in Norman. We have some events coming up. Another one at one of the schools. I believe it's a junior high this Saturday, and that's in Norman as well. So hopefully we have more there. And then we identified that cluster of the India variant. And of that cluster of cases, 80% of those cases are now eligible for vaccine. At the time they were not. So that means they were 12 to 15-year-olds. And we are hosting a couple different events for those groups to help them with not only testing, but vaccination. So we've put out a letter to that specific population, and we're working on that as well. Much like Dr. Bratzler was saying, and as you guys have done with the city of Norman, we're doing a lot of what we call strike teams, but we go out and focus on populations that have lower vaccination rates, just like he was talking, trying to hit those that it's really about 20% of the population at this point that aren't really decided on vaccine, or they want it, but they don't really want to put a lot of effort in going to get it. So we're going to go to them. And that's what our strike teams are for. We have 2 vans and also a mobile health clinic. And we have a ton of events that we're working on scheduling over the next several weeks. And we'll just continue to do that throughout the summer as well. We're working with the schools to continue to offer vaccine to the kids. We're really focusing on churches, and the Y and different groups that have summer camps, so that we can maybe have events prior to those summer camps where the kids can be fully vaccinated before they even go to those camps, because we don't want to see more clusters like we're seeing in this one community right now. So we're really excited about that 40% in not only Norman, but Cleveland County specifically. And of that, we're exceptionally proud of the 65 plus population. We're looking at about 80% of that population being fully vaccinated, which is in Norman alone, and we're really proud of that. So that's where we are right now.
Well, you guys have done an outstanding job, and I really appreciate that. If a church or a group or someone wanted to ask for one of these strike team pop-up clinics, how would they go about doing that?
Yes, they can call our health department and ask for me. They can ask for Mike Potter. He's one of our local emergency response coordinators, or Lauren Spangler. She's a vaccine coordinator. If for some reason they just forget our name or can't think of who to ask, they can just say, we're interested in vaccine at our facility. Here's our name, here's our phone number, and how to get a hold of us. And they will get the message to us, and we will give them a call back and get that scheduled.
Excellent. And my last question for now, are we still doing contact tracing? It's got to be far more manageable with these such low numbers.
We are. We have a specific team that does all of our contact tracing. And then, of course, any case that comes up that has been what we call a breakthrough case, it's a fully vaccinated person that is now positive. we're working with the state epi and their team as well to do sequencing to find out what kind of variant it is, and to identify possible clusters or where they could have become positive again. So we have different avenues of doing the contact tracing, but we are on top of it for sure.
Awesome, thank you. Councilmember Studley.
So first, I just want to say thank you, Ms. Kanak. I appreciate all the work that you do in our community. And I think what you're talking about Saturday is that the mutual aid fair that's going to be at Irving Middle School at noon. Yes, there will be vaccines there. So thank you so much for that.
Yes,
I just wanted to verify real quick about the Pfizer. Is that going to be the Pfizer vaccine that you're dosing for the kids?
It is, yes.
Yay.
Yeah, we'll have Pfizer vaccine there, yes.
Okay. And then you had mentioned that you worked with an epidemiologist. Am I saying that right?
Epidemiologist? Yes, ma'am.
Yes. So I'm curious if you guys were aware of the report from Johns Hopkins where there was 723 epidemiologists, I believe, and they're recommending not lowering mask mandates until we reach at least 70% immunity, and that includes kids. So I was curious if your people had considered that or what your thoughts were on that.
We are aware of that. We follow CDC guidelines, and then the state kind of tells us where to go from there. I know, much like Dr. Bratzler was saying, we will strongly recommend masks in our building. We'll definitely require them in the clinic setting or any type of medical type setting. When we're doing any type of testing or vaccinating, we'll wear them. We will ask all of our staff to wear them in any type of customer facing situations. But and if anybody is not vaccinated, we'll require that they wear them in any of our buildings as far as our staff goes. But overall, we would love to, follow some of those guidelines sometimes, but we go with the state and the CDC guidelines because they see the whole picture, and we've got a great team.
Great, thank you, I appreciate it.
You're welcome.
All right, for Dr. Cook, she found out that the decision on the mask policy for summer school will be made on May 24th, which is next week. So I think, again, we're all watching, seeing what's happening. And would you like to fill us in on Norman regional numbers? Do you have those?
I know that we had one day with 0 COVID patients. We finally reached that number. And then we've been hovering single digits, definitely, under 10. So we're in much better shape. And visitors are back in, and it's feeling a lot more normal. I will report from a pediatric standpoint, the normal respiratory viruses are back. So it is what it is.
That was a fun fact that I think Richie Split shared with me. Not only are we in single digits, but COVID is not the most prevalent virus right now at Norman Regional. And I think that speaks volumes. So, and should it return, I'm sure you all are battle weary, but you know how to work it now. So it is not as novel as the novel virus was a year ago. So thank you. Do we have any other questions for our guests before we continue? All right. Thank you both for being here.
Oh, one other little tidbit. I know that kids are not as severely affected with COVID, but we have had quite a number of kids admitted, particularly to Children's Hospital with multi-system inflammatory syndrome in children, which, when you compare to other respiratory viruses that we're used to dealing with in the summer, like, I mean, in the winter, like lots of kids are admitted to the hospital with RSV. So I know this is different because it's new. I want to emphasize that, yes, some kids get very sick from this, but most do well. I want to encourage people to get vaccinated for that reason alone, that, yes, it is protective of your kids and not just of the community and herd immunity in general.
Thank you. Jackie, any last comments from you as well?
No, I'll just add to on what Dr. Cook was saying, in that when you vaccinate your kids, you're protecting the elderly too, who then go visit parents, grandparents, aunts, uncles, and some that don't have as strong as an immune system as our kids and ourselves. So it's definitely important.
Could you clarify one more time the walk-in hours at the Cleveland County Health Department?
Yes, absolutely. So for the Norman location, it's Monday and Wednesday from 9 a.m. to 3:30 p.m. And in Moore, which is our other Cleveland County location, it is Thursdays and Fridays, same hours.
Thank you. Councilmember
You're
Trump.
welcome.
Dr. Cook, I just thought of this for anybody who's watching at home, any parents that are watching at home. Are there any particular common complications that a 12 to 16-year-old might have that would make them ineligible for the vaccine?
No, I mean, so an allergic reaction. So a known anaphylaxis to a vaccine component may disqualify you from getting it, but in general, there aren't specific medical conditions that disqualify kids. And, for those who are immunocompromised, it would be something to discuss with their doctor on whether it would be advantageous to go ahead and get vaccinated or if their specific condition keeps them from doing it. But the majority of kids should be fine to get it.
That's great. Thank you.
Any other questions from council regarding this item? Thank you. Seeing none, this is an opportunity for members of the public to make comments regarding this item. Are there any public comments?
Seeing none, Mayor.
Thank you. Are there any final comments from council regarding this item? Councilmember Hall.
I just want to offer my thanks to Dr. Cook and to Ms. Knack too for all of the input that they've had all year long. It's just been invaluable to have a team of so many partners in our community being able to work through all of this. So appreciate everything that you've done as well. And my only final comment is just really to continue to emphasize our role as a city in providing the most up-to-date information that we can. So I know we have been, working really hard and have a robust page on our city website that addresses COVID-19 information. So I'm hoping that we can update that information as quickly as possible and also maybe add to the frequently asked questions piece of some of the things that we've talked about tonight. Because I just think that as we're in this transition and everyone's trying to understand what all the CDC guidelines, the implications of all of that, the more that we can take advantage of using our ability and our voice to get information out to our residents, the better.
Excellent point. Thank you, Councilmember. Councilmember Studley.
Yeah, I just wanted to say I have had a few messages from my constituents, and I understand your concerns. I feel like we all have those concerns because this is all new ground for all of us. We don't know what is going to happen when we lift the mandate, but just as we followed science to get here, we also need to follow science to continue on in this process. And so the fact that we've heard from some really reputable people in our state that have given us numbers such as 1 out of every 100,000 people, I feel like those numbers are significantly low enough that it is okay right now to go ahead and try it without the mask for people that have gotten the vaccine. The fact that we have clinics that are popping up everywhere for kids 12 to 15 to now get those vaccines is awesome. So I just want to, again, thank you, Jackie, for doing that. I know that was the biggest concern is how are our kids getting vaccinated? So it sounds like we've already gotten a really great start with that. And then finally, I just want to say, as long as we're watching the numbers and Mayor Clark is paying attention, like I know she always is, I am reassured that if anything that we see a spike in numbers, that she'll definitely try to reinstate this mandate with the help of council. So just know we are watching, we are aware, we hear your concerns, but we're also following the science. So thank you.
Thank you, Councilmember. All right, The motion on the floor is to adopt the ordinance on second reading. Madam Clerk, will you please call the roll?
We already did that one. Do you want to go ahead and do the emergency one?
I don't think we voted on the second
I think
reading.
we just did
think we
the
did.
motion for the second.
Okay. Apparently I wrote it down that we voted. We'll do it one more time. Councilmember Studley,
Aye.
Councilmember Schuler,
Aye.
Councilmember Patron,
Aye.
Councilmember Hall,
Aye.
Councilmember Nash,
Aye.
Councilmember Foreman,
Aye.
Councilmember Holman,
Yes.
Councilmember Peacock,
Yes.
Mayor Clark.
Yes,
The ordinance passes upon second reading unanimously.
thank you. I'll now entertain a motion to adopt or reject emergency section 3.
So
So
moved.
moved. Second.
Thank you. The motion on the floor is to adopt emergency section 3. Madam Clerk, will you please call the roll?
Councilmember Studley,
Aye.
Councilmember Schuler,
Aye.
Councilmember Patron,
Aye.
Councilmember Hall,
Aye.
Councilmember Nash,
Aye.
Councilmember Foreman,
Aye.
Councilmember Holman,
Yes.
Councilmember Peacock,
Yes.
Mayor Clark.
Yes,
The emergency section passes unanimously.
thank you. I'll now entertain a motion to adopt or reject the ordinance on final reading.
So moved.
Second.
Second.
Thank you. The motion on the floor is to adopt the ordinance on final reading. Madam Clerk, will you please call the roll?
Councilmember Studley,
Aye.
Councilmember Schuler,
Aye.
Councilmember Patron,
Aye.
Councilmember Hall,
Aye.
Councilmember Nash,
Aye.
Councilmember Foreman,
Aye.
Councilmember Holman,
Yes.
Councilmember Peacock,
Yes.
Mayor Clark.
Yes,
The ordinance is adopted upon final reading unanimously.
thank you. Ms. Walker, this means that our mask mandate is no more as of right now. Is that correct?
That's correct.
What I would like to emphasize to everyone watching and to everyone who's not watching, you need to get vaccinated. And if you choose not to, please continue to wear a mask. And if you see someone wearing a mask, there will be no mask shaming because as we have covered, even vaccinated, there are people who are immunocompromised that do not have as high efficacy rate as everyone else. So please let us respect each other's choices and individualism and get vaccinated. With that, on to item 2, discussion regarding the proposed FYE 22 City of Norman budget enterprise funds. I'd like to recognize Kim Kaufman, our budget manager, to make a presentation.
Good evening, council and mayor. I'm gonna share my screen here. Everybody see that? Thumbs up, okay.
Yes.
So this is just going to be a financial overview of the fiscal year ending 22 budget for the enterprise funds, which of course are our utility funds. Our Director of Utilities, Chris Mattingly, is here to assist, as well as our Director of Finance, Anthony Francisco, joining us from the Mont. So let's get started. This is our budget calendar. You can see here in the red, we are more than halfway through the process. This process does begin every September with the Finance Committee discussions. So far, we've had 3 capital budget sessions. We've had 1 public budget hearing. We've had an overview of the general fund and the special revenue fund budgets for fiscal year ending 2022. Today, we're going to go over the enterprise funds. And then we have 1 more public budget hearing. We'll have an optional follow-up on June 1st. And then on June 8th, the council will consider the budget for adoption. So the enterprise funds are comprised of the sanitation fund, the water reclamation or sewer fund, and then the water reclamation fund has 2 sub-funds, the sewer maintenance fund and the new development excise tax fund. The enterprise funds operate like a business where the charges for service should cover the cost to provide those services. So we'll start with the sanitation fund here. We've collected over 100,000 tons of trash within the residential and commercial divisions. And we've processed 29,000 tons per year of yard waste and compost. We started curbside recycling in 2008. Republic Services is our current operator. We do have over a 90% participation rate, and we collect over 5,000 tons a year of curbside recycling. We do have 4 recycling drop-off centers for our customers, and we collect over 1,700 tons per year at these centers. This does include a new hub at the transfer station for scrap iron, wood, and glass. 560,000 pounds of glass was recycled into bottles and insulation this past year. So every year we do a utility rate comparison. I think this is fascinating information. You can see a comparison of our sanitation rates with 15 other benchmark cities. Most of them are in Oklahoma, but we do have 2 in Texas and 1 in Kansas. Our trash pickup is $17.20 a month, and that includes a bulk trash pickup in the spring and in the fall. This is 1 week collection of I think it's a 96-gallon polycart. You can get an additional polycart for an additional $7 a month. Once a week yard waste collection, free brush drop off, 4 recycling drop off centers, free compost as available, and then of course the curbside recycling, which is included in that $17.20 fee. It's $3 of that. You can see that there's only 6 other cities that have lower sanitation rates than the city of Norman, and only 3 of those also have curbside recycling. So I think we're pretty competitive. The average sanitation rate is $17.86 within these benchmark cities. So we're about 4% below the average, not too bad. Major revenue assumptions for the sanitation fund. The sanitation rate increased last in April 2011 to this $17.20 fee per month. And again, it includes the $3 curbside recycling and then 20 cents for the Oklahoma solid waste management charge. The additional polycart is $7 a month, and revenues have been estimated at a growth rate of 1.7% per year. Major expenditures in the sanitation fund. In the fiscal year 22 projected budget includes just over $3.7 million in fleet replacement purchases. The bulk of that number is going to be the trash truck replacements. Those are almost $400,000 a piece. So they're expensive pieces of equipment. The landfill expenses increased 7% from fiscal year 21 to 22, and that's an annual expense of just over $2 million. Our recycling contractor expense with Republic is budgeted at $1.56 million, and that is a 2% increase over last year. The fiscal year 22 ending fund balance for our sanitation fund is $7.7 million. This is for, yes, fiscal year 22. Major projects from fiscal year ending 21 to be completed in fiscal year ending 22 include the household hazardous waste facility construction. That's a $1.65 million project. And then the construction of our container maintenance facility, that's just over $1 million. Major projects to start in fiscal year ending 22, the new sanitation facility at $2.5 million, and the compost facility scale house. I think there's some questions. I'm not sure if Councilmember Patrone or Councilmember Holman was first.
Councilmember Holman.
Thank you. So just for clarification, the recycling part is part of the sanitation, but does the recycling fee require its own separate vote to raise? Is that the way I understand it?
All changes to the utility rates require a vote. So yes, the $3 recycling fee would require a vote to change.
But that's not the same as raising the sanitation rate.
No, sir, it would not require a separate vote unless council chose to do it that way.
So the last time sanitation / recycling rates have been adjusted was 2011.
Yes.
Okay. Just wanted to clarify that. And I do find it somewhat concerning about the increase in tipping fees, 7% increase this past year and $2 million per year. I just want to kind of emphasize to our residents around the city how much it costs to dispose of waste. Really, it's a lot of money, and just would encourage everybody to be really aware of that going forward, and that it's becoming more expensive, not only to get rid of the waste in the landfill, but it's becoming more expensive to recycle it too. So that's all I've got on this one. Thank you.
Councilmember Patron.
So recycling issues are probably the number one non-controversial complaint that I hear. So I wanted to touch on this for just a little bit. I don't know if the city manager is on the call because I can't see all the faces anymore. But
He is.
Yes.
Okay. So I think we have discussed in the past, I know that you were doing some investigative work to look into see if we could move to an incinerator, use for energy our garbage.
The answer is absolutely, and we have made great progress working with our friends at Johnson Controls. We believe we will be bringing you a memorandum of understanding that would lay out the scope of a project that we have discussed on a piece of real estate owned by the city down by our transfer site. And right now, the folks at Johnson Controls are doing some scaling of the project based on the tonnage of solid waste and materials that we used to recycle, but that we can't recycle them anymore because nobody will take them. This project would be done with a firm out of Minneapolis that really has some support from the EPA based on the amount of reduction of volatile organic compounds that are being reduced into the atmosphere through this process. And even better news, this project right now is being scoped so that the city of Norman does not write a check. They bring the product, they build the facility, they own it and operate it. We bring them trash and save on that tipping fee. And they get a variety of tax credits available for renewable energy that are not available to the public sector, only to the private sector. They will control that output, whether it be synthetic gas that goes into the natural gas pipeline or electricity derived by running synthetic natural gas through a fuel cell. And at the end of each year, we should expect to receive a check. So making great progress. Hope to be able to bring that to council in the next handful of weeks.
That is very good news. So at that point in time, after we hopefully get that in place, I can't imagine that it wouldn't pass. There will be instructions given to the residents about how to go about glass, for instance. Or, I mean, is there anything that they would need to know at that point, or is it just that the big green is going to go into the incinerator?
Basically, these systems are designed to receive anything except glass. Well, no, they can receive glass, anything but steel and rock. Everything else could be run through such a machine.
Nice. Okay. So I think that is the first part. And I guess knowing that, I find it unlikely that we will be looking into raising any rates on anything until we know, because it sounds like this is going to alleviate a lot of expense with that 1.656 million on recycling and or the 2 million at the landfill. Or do we not? I mean, are we going over and
Can I
beyond
speak to
the-
that? This is Chris Mattingly.
He's great.
Yeah, the sanitation fund is healthy. We feel good about the sanitation fund going forward. The wastewater fund, it's slightly to the positive, and we think it's going to be good for the next few years. And then the water fund is the one that we're all going to need to address. So I think that's how we'll proceed through this.
And then let's see, while we're still on trash, the hailstorm caused quite a bit of aftermath wreckage trash. And unfortunately, in my ward, we were already past our big trash day. I know in other communities, they do curbside big trash pickup more often than twice a year. And I'm wondering if, for instance, my mom has Oklahoma City trash and they're able to do every week. They just put something out. I don't expect that, but I'm wondering what if council wanted to budget to do this more often, perhaps, I don't know, maybe once a month. What would that look like? What does it cost roughly to do a big trash pickup?
The fall cleanup and the spring cleanup, they cost us about a little over $100,000 for each event.
Okay.
The trick is you have to run the whole route, and we don't have, what we do on those two fall events and the spring event is we actually have people come in on overtime and do it on weekends. And so they work extra. And so it'd be difficult. We'd probably have to, hire an outside crew or something if you wanted to do an additional pickup, because we actually had a hard time getting volunteers this last time. Folks are, even though it's time and a half and overtime on a weekend day, just weren't as willing to participate on this last event. So we really struggled, and actually didn't get everything picked up by closing hours on late Saturday night. And then we had to come back on a Monday and pick up a few that we missed. So we could do it, but I'd have to put a pencil to it, and it'd cost money. So.
Well, it definitely would cost money. I can appreciate that. I would be interested to see what, if we were to go to maybe like a quarterly pickup, and if it's 100,000 an event, or if we need to raise the time and a half to where, we can entice more people to want to do it. I think we're seeing more electric cars, smaller vehicles. So getting to the transfer station is getting difficult when you see less trucks and SUVs on the road. So I would be interested to see, and even if it was a rotated, only 2 wards at a time or something, for you do definitely fall, definitely spring, and then a floating. I don't know. I would like to see different ideas put out there, because I know that already in my neighborhood, there are side yards that are full, just waiting for the fall pickup. And that is, it's not good for termites. It's not good for a whole lot of different reasons, pests. So if
I will say we are looking into, instead of the fall and the spring cleanup, looking at hiring a crew for having a picker truck that actually goes out and can pick that up and put it into the truck. And we're gonna cost compare that. So I will bring that forward to see. I think it's going to be more than the $100,000 event. So, but we could see what those numbers are, and I can bring it forward to share with everyone.
I would really.
I'd just like to add there that customers always have the option currently to call sanitation and order a bulk trash pickup at any time. It's a $25 charge, and you just call the number on your trash can, and they'll schedule it. They'll come pick up your bulk trash, and they'll add $25 to your water bill. So that is an option currently as well.
Yes, that's right.
Okay. And then, just one more on that point is, when we're considering the aftermath of storms, I think it would behoove us all to have that conversation as far as all of these neighborhoods being full of stuff that they might not have it on the curb right now. They're trying to hide it and be pleasant, but they have this stuff. And it doesn't take glass, and all these windows were busted out in recycling. So they put most of the glass into their big greens, but it's a whole lot of other stuff that's, that's back there. But anyway, okay, that's all I have for right now. I appreciate you all.
Councilmember Peacock.
Thanks. Just gonna add a little bit to Councilmember Patron's last point. I think Oklahoma City has a program that they call Saturday Morning Sweep, in which the city basically provides a roll-off dumpster, and then neighborhood residents kind of organize around a cleanup effort. And then once the dumpster is full, they call the city, and the city comes back and picks it up, no charge. I don't know if we're able to replicate something like that, but it seems to be a pretty popular program up there. So love to see something like that.
Yeah, that's very doable there.
Okay, awesome. I'm glad to hear that. Going back to recycling, given the increase in online ordering and all the packaging and shipping materials that are associated with that, what would it take for us as a city to provide recycling once a week instead of every other week? Is it just an extra $3 a month charge to residents?
It really is. It's the cost is driving around and touching everyone's cart. That's the cost. We don't get much back from what they do with the material. So that it really is, if we did that, it's right now, they're doing it for a little under $3. And it would probably be another $3 on top of that if you wanted to do it twice as what we're doing.
And so, Daryl, you might have an answer for this. Would that need to go to a public vote? Or could we just administratively say we're doing recycling every week now, and the cost is passed on to the consumer?
It depends. We'd have to do the math and look at it budgetarily. If we can make it fit with the existing revenue stream we have, we wouldn't have to go to a vote and do that. Just a matter of what the program change impact to the solid waste budget winds up being.
Okay.
Currently, customers have the option to add a second recycling bin as well for an additional $3. So that could solve that problem. 2 bins twice or every other week pickup. Yeah.
I think that might be a solid compromise. I'd really like to see what the math breaks down to, but I think sounds like there's some options. And then, kind of going down that same path, how far off would we be from doing commercial recycling at that point? I know that's probably a pretty loaded question.
Yeah, that's a tricky one. We haven't gone for the commercial. Is Brett on the line? He's my expert on the recycling.
Yeah, I'm here. We did a pilot program. Can you hear me, Chris?
Yes.
We did a pilot program for commercial recycling, and it was pretty successful. We went after apartment complexes, and we had good participation rates. And with a few exceptions, it came out clean enough that we could sell that commodity down the line. When we ended the pilot program, of course, there's a cost associated with it, and recycling cost about 3 times as much as trash collection because you have to handle it 3 times. When we went back to those same participants at the end of the pilot program and asked if they would like to pay the fee to continue the program, they unanimously said no. So we ended that pilot program on that point, and it told us that the willingness of the commercial enterprises in Norman were not strong enough at that time to continue with that. So I think that was a little bit selective in that we just went to apartment houses. If we went to individual stores, the average container cost about $3,000. Again, it's a cost, a capital outlay, and a return on capital investment that would get you in trouble, I believe.
And the reason I ask is because if you think about gas stations, grocery stores, a lot of the businesses out there, aside from restaurants, what they produce is, for the most part, one-time use plastics that are, majority of which are recyclable. So I feel like there might be an increase in cost, but the wash is that's being diverted from our waste fund and now going into our recycling fund. So it might be an increase, but I don't know if it's as dramatic as it might seem at first glance. So I'd love to.
Well, I think the cost is in the infrastructure, in the collection vehicle and the $360,000 collection vehicle you'd have to buy, hiring the employee and the containers that you'd have to buy at about $3,000 a piece. So that's the part you'd have to do the pro forma on and determine at what rate would we collect these recyclables. We're already providing a commercial recycling for OCC, which is very successful. And now that the commodity prices have returned, the revenue line on that might get us to that nice little break-even point you want to be in cardboard recycling. So we have great participation there, and it's ongoing.
Well, I'm really glad to hear that. I'd love to see kind of this take the next steps and what is possible going forward. So I appreciate the input. That's all I have.
Councilmember Schuler?
Yeah, I just had a question on a clarification on how the benchmark cities are selected and why those cities and why that comparison for our rates.
That's a good question. These are cities that have similar demographics, or let me go back to that. So for the Texas cities, I mean, they have similar demographics. Denton is a college city as well. And the other cities, they're kind of, they have similar demographics as well, maybe not in population, but that's a good question. These were the benchmark cities that we've been using for a while. And so I continued because we have, the historical data from these cities.
Right. And I remember when they chose them, it was a prior council that we started off with other cities in Oklahoma. And then they said, well, let's choose some outside of Oklahoma. And then they said, let's choose some other college towns like us. And it just kind of got compiled. And Suzanne was prior to Kimberly. And we just kind of stayed with that so we could kind of watch it and compare to it over the years.
And I would point out, these are our benchmark cities in most cases, not only for the utility rates, but also for our bargaining unit comparisons and for a lot of other things. And it is those demographic comparisons. And there's a discussion of that. I'm trying to find the page in your budget document, but there's a discussion of why those cities are chosen.
Okay, yeah, I just was wondering, how do they stack up? And if we're using those for other benchmarks, then I think that's could be relevant to see kind of across the board what they're doing in different areas within the city. But just was curious why. Like, I understand some of the Oklahoma cities, but also like some of these are wildly different in population, and so that could really change different rates and different things like that. So that's where my question was coming from. But Anthony, if you could point me to the clarification on that in the budget document at some point, that'd be great.
It's on page 8, council member.
Awesome, thank you.
There's no other questions right now, Kim, if you want to move on.
Okay. So I think we were major projects to start in fiscal year 22, the new sanitation facility at $2.5 million and the compost facility scale house at $420,000. And I will do my best to keep an eye out for questions so you don't get overlooked. We're moving on to the water fund. Water production produces over 4.8 billion gallons annually, and they run 24 hours a day, 365 days per year. And this is a picture, an aerial view of the water treatment plant during construction, this past expansion. So water line maintenance maintains over 625 miles of water pipe with diameters of 6 to 48 inches, and they maintain over 6,400 fire hydrants. They repair an average of over 180 water line breaks each year. They replace about 8,000 feet of old or undersized water mains each year. They repair or maintain over 1,000 fire hydrants, and they maintain over 40,000 water meters each year. And this is a nice picture of a big water break or water main break. Water rate history. So in 1999, we adopted an inverted block rate to encourage conservation. And this is a progressive rate structure that charges higher rates to the highest water users. The higher tiers affect 25% of residential customers. In March 2006, a water rate increase was approved. In August 2010, a water rate increase failed. In January 2015, water rates increased to the current levels to fund water treatment plant improvements and obtain 2 million gallons per day of additional groundwater supply. And as Chris touched on earlier, in fiscal year ending 22, a water rate increase is needed to fund upcoming projects. And you'll see on future slides that we've already done some significant project delays to fit within the budget we have currently. Our current residential rate structure, our base fee is $6, and then it's $3.35 per 1,000 gallons for usage of 0 to 5,000 gallons a month, $4.10 for usage of 5,001 to 15,000 gallons. So you can see this is a progressive structure. There's a summer surcharge during July and August of 35 cents per 1,000 gallons for usage over 20,000 gallons a month. And then we've had a mandatory odd and even day watering rotation system. So this structure is set up to encourage conservation. And back to our utility rate comparisons. Let me see what I have on my notes here. There, of course, you can see here there's 3 cities with lower rates than Norman, so we're very competitive here. For 10,000 gallons of usage, the average among these benchmark cities is about $57 a month. Norman charges $45 a month for usage of 10,000 gallons. So we're about 22% below the average within these benchmark cities. Major revenue assumptions for the water fund. User fee revenues are estimated at a growth rate of 1.7% per year for projected customer growth. Effective August 1st, 2016, the water connection charges were increased, and it's $1,000 for a 3/4 inch meter, $1,667 for a 1 inch meter, and $6,667 for a 2 inch meter. The water rate increase that we were discussing earlier, we hope to have this on the ballot in November of 2021 with the first reading in October of 2021. So we did include half of this proposed rate increase in the proposed fiscal year ending 2022 budget. It's $2.4 million is what was included in the revenue for this increase. Expenditure assumptions. Our interim water purchase contract with Oklahoma City is $1.3 million. It's 1 million gallons per day take or pay at 2.44. This was what was in 2021. It was 2.44 per 1,000 gallons, and we are looking at a 4.7% increase from 2021. In Oklahoma City, our Oklahoma City water usage accounts for about 7.6% of our usage. There's a question.
Councilmember Patron.
I'm sorry, just for clarification purposes, I didn't understand. Was the proposed November water rate increase, did you say that that included a connection fee? I thought that was a council action.
The connection fees were increased in 2016, but the water rate increase is just for the water rates, and we're hoping it'll be on the November, on a ballot in November, but that's of course up to council.
Okay, so 2 different things is what you were saying then. So you weren't, I misunderstood. I thought the connection fees was a council thing, which it was in 2016, but you're not suggesting that connection fees go to a vote of the people, or you are suggesting that it would go to the vote of the people?
At this
No,
point,
no. Connection fees are a council ordinance decision.
That's what I thought. So I guess I just got confused because it was back-to-back bullet point, but anyway, okay, I'm back with you. So no, for those watching at home, it's just about whether or not the water rate itself for all accounts would be increased and whether or not connection fees would be increased would be up to council. Right?
Yes.
Okay, the next point, Central Oklahoma Master Conservancy District. This, we have 900,000 budgeted for this and proposed fiscal year ending 22 budget. It's the replacement of a raw water line in Lake Thunderbird. It supplies water for Norman, Midwest City, and Dell City, and Norman's share is 43%. 548,000 was included in the fiscal year 22 budget for fleet replacement purchases and other equipment for water treatment and line maintenance. And the fiscal year 22 ending fund balance is projected to be 3.2 million. The projected balance in fiscal year ending 23 is a negative 13 million due to construction timing. Water projects from fiscal year 20 completed in fiscal year 21. Robinson Waterline Phase 2, Brookhaven Creek to Water Tower, 3.2 million. Robinson Waterline Phase 4, 24th Northeast to Water Treatment Plant, 2.3 million. Segment D, 24-inch water line Phase 5, Timberdale from Chautauqua to Jenkins, and Jenkins from Timberdale to Constitution, 4.5 million. Parsons Waterline west of campus, 860,000. Phase 2 water treatment plant improvements started in June 2017, including UV disinfection, ozone treatment, new chemical building, and equipment storage. Total project with engineering was 35.6 million. It was completed in December 2020. There's a question?
Councilmember Holman.
Thank you. Really, I just want to highlight that second to last bullet point for anyone that isn't familiar or aware that that yes, we've recently, the city has completed a $35.5 million improvement project to the water treatment plant, phase 2 of it actually, and that was a big piece of the water rate increase from 2015, and is part of our 2060 strategic water supply plan as well. So for any folks that are concerned about water issues in Norman and what we're doing, we've been making some very significant investments in improving our treatment plant, thanks to voters increasing those rates in 2015. So I think there's a pretty good, solid track record of our utility department wisely using the increased rates that voters approve and providing results like this list right here of things we've done, promises made and promises kept. So I would just encourage everyone to keep that in mind over the next several months as we talk about potential rate increases, that we do have a water supply plan, a 2060 plan, and we have a track record of fulfilling the promises that prior councils and city staff have made to voters. So I just wanted to make some comments about that. Thank you.
Yeah, thank you for that. That you're exactly right. And as I bring up the rate increase PowerPoints in the future, that's exactly what I'll do. Is I'll show projects that were promised as part of the last rate increase, and then the check marks that we completed those as we said we would. So thank you. Good point.
And finally, here the backwash tower rehabilitation at 280,000. Major projects from fiscal year ending 21 to be complete and fiscal year ending 22 is the FY 15 water well supply lines at 10.7 million through fiscal year ending 21. The Robinson water line phase 3, 24th Northwest to flood at 2 million, and Gray and Tonawah Street water line replacement at 2.3 million. This is a depiction of the Robinson Street water line replacement. over 6 miles of 30-inch diameter pipes. You can see these black areas, they've already been completed. This is from the water treatment plant down to the Brookhaven Tower. This green section right here for 2.1 million, it's under construction. This is a future section of this water line. And this orange section right here is in the design phase right now. More water projects, major new water projects for fiscal year 21-22, Interstate Drive water line replacement at 1.4 million, water line replacement, Flood Robinson to Venture at 5.3 million, James Garner water line replacement, which is a collaboration with Public Works, which means that as the roads are refinished, the water lines are repaired or replaced. Robinson Library to Robinson at 930,000, Maine to Duffy at 1.1 million. Porter water line replacement at 900,000. This is also a collaboration with Public Works. Jenkins water line replacement at 700,000. Urban water line replacements and fire hydrant valve upgrades completed by line maintenance crews, 300 to 400,000 annually. And South Lake Addition water line replacement at $1.2 million. Major new water projects for fiscal year ending 22 and beyond. Initiate, let me look at my notes, the advanced meter infrastructure at 350,000. These are the smart meters. This would require an additional 17 million in later years. The well field blending at 3.2 million and will require an additional 16 million in fiscal year ending 23. This is a solution for the DEQ chlorination requirement. DEQ requires us to have a chlorine residual throughout the distribution system. The corrosion control study at 75,000. The lead copper rule to ensure we're meeting current industry standards under the lead copper rule. Cybersecurity at 175,000. The American Water Infrastructure Act, and water tower coating at 1.1 million, Cascade and Boyd. The final slide on water projects, future water projects subject to funding. A lot of these have already been delayed or postponed due to budget shortfalls. The line maintenance building, 3.2 million, has been pushed back to fiscal year ending 23. This is also going to get a match of 3.2 million from the water reclamation facility. Yes, sir.
Councilmember Holman.
Thank you. This could be a water reclamation fund question, perhaps, depending on decisions that may or may not have been made yet. But a project that I'm very interested in is the Lindsay Street Water Tower at the railroad tracks. It's a water tower that's not currently in use, but it is starting to rust pretty badly, visibly. And one of my concerns is that it gives the wrong visual impression about our water system. First off, people drive by it and they see a rusting water tower. They don't know that it's not in use. I could see that being an issue. I also think it's a real iconic piece of Norman's history. It stands very visibly in the skyline, especially if you're driving down Lindsay Street from either the west or east. And in CPT committee last year before COVID, I did ask staff to provide an update about that water tower, about what it would cost to get it repainted. I know it has lead issues potentially. And the discussion back then was about interest from OU and the city using it for a reuse type of situation. And so I was kind of wondering what the status of that is. And if there hasn't been any decisions, if we can think about, at the very minimum, repainting it, because like I said, I do think it's a really important piece of Norman's history. So I don't want it to be taken down. And I think it's a great idea to use it, to repurpose it for reuse type of stuff. So in partnership with OU. And so I don't know if you might have an update about that, Chris.
I do. Yes.
Actually, I do too. And Chris, I'll touch base just on the OU component.
Exactly.
Staff did meet with OU staff And at the staff level, we have reached an understanding that the University of Oklahoma will be budgeting for and repainting water tanks on campus. And they did express interest in participating in repainting and branding this particular water tower, along with the other on-campus water towers with a big OU symbol. So then COVID did slow us down a little bit, but it does sound like the OU budget will allow for this joint venture on the painting preparation and then the final paint job in conjunction with the university. Mr. Mattingly is fully versed on how that tank will become part of the city's overall water system solution.
Right. Yeah. And we have intentions to use that as a non-potable tank, like you mentioned, to help future of irrigation of Reeves Park, the ball fields and what have you down there. And we've already laid some purple pipe when we did our Timberdale project. It went down along Jenkins. We've already laid a pipe. It's in the ground and ready for us to connect to. So we've started that and just haven't finished it. But yes, that'll be the end goal. And then OU we talked with them in February. It was right before the Snowmageddon. And their budgets got hit pretty hard because of the natural gas purchase. So I'll get back with them and get that going again of how much, the partnership we can work on that, who pays what. So
I definitely appreciate that. I mean, I love the idea of it having the OU symbol on one side and the city of Norman on the other, or something like that. But like I said, at the very minimum, I mean, I would be interested in, whatever council might need to do, options to explore funding on our side, because just from a visual standpoint, the way it's looking right now is pretty rough. And given, the perception folks have about our water, even though I think, our water is extremely safe and tested all the time, and our staff does a wonderful job. But visually, when people drive by that tower, it does look pretty bad, I would say. And so, again, since we had discussed it right before COVID hit, I was very interested in an update on that. So I definitely appreciate you getting back in touch with the university about plans, hopefully sometime soon, to get that fixed up. Thank you.
We will do that.
Councilmember Nash?
Yeah, are there any laws against painting water towers? They're all crazy and artistic, kind of like the ducks that we have around town, because in every town's got a water tower with their name on it, but none of them have a water tower that's painted like a pirate. Would that be breaking laws if we did that?
No, it's allowed.
Fantastic.
I
Thank
support
you.
wild designs too.
Appreciate it.
And the good news is those water towers are multi-sided. You could do more than one thing on one water tower and maybe check a lot of boxes.
Okay, Kim, I think you can go ahead.
So the line maintenance building has been delayed to fiscal year 23, and that is split half with the water fund and half with the water reclamation fund, as it will house both water line maintenance and sewer line maintenance. And the Flood Avenue water line grade of Robinson, 1.9 million, scheduled to begin in fiscal year ending 25, pushed back from 21. Annual water line replacement program, $3.3 million annually, delayed from fiscal year 21 to 26. The Robinson 30-inch water line, 24th northeast to flood, 5.3 million, delayed from fiscal year 21 to 23. The Alameda 24-inch water line, 24th northeast to Carter, 3.5 million, delayed from fiscal year 23 to fiscal year 25. The Hall Park water line replacements, 440,000, delayed from fiscal year 21 to 24. And then finally, the Southeast Norman water tower, 3.5 million to begin in fiscal year 27, originally scheduled for fiscal year 23. And Chris, did you want to touch on this complicated image
Yeah,
here?
this is just, as you guys know, the pilot project at the water reclamation facility. Our strategic water supply plan is told us to move forward with advanced treatment of the water coming from the water reclamation facility, and then discharging that into Dave Blue, and then augmenting the lake supply with that, which then it would be pumped back to our water treatment plant and then treated to a high caliber for drinking water. And so I would just kind of show this as that pilot project is underway right now at the water reclamation facility. And I'll be happy to give tours starting in about a month. We're still getting the processes set up so we can have something to watch and observe. So.
Councilmember Nash?
Have you tried drinking the water yet?
No, not yet. First, the pilot will be just to remove, actually phosphorus and nitrogen are going to be the trick at first, because the lake has algal blooms. And as you know, our stormwater is making good efforts to try to reduce all the phosphorus and nitrogen going into the lake from their point, from non-point sources such as yards and different stormwater runoffs. And then we're wanting to put the water reclamation facility water in the lake, and DEQ is concerned that if it has any phosphorus or nitrogen in it, that would be going in the wrong direction for the lake. So we're working teamwork with stormwater, Dr. Evenson, and we're going to try to see kind of a watershed approach of, could we pull it off? Could we treat it good enough? Could we maybe then help with some of the stormwater, reducing some of that phosphorus, nitrogen, so that we could use this as a water source to augment our lake, because our lake, we're overusing the firm yield of our lake at this time. And it concerns us if we have some drought patterns show up again, as we've had in our past. So.
Thank you.
Councilmember Studley?
Yeah, I was just curious if you could share with us if this is being done in other cities and what that looks like, and if currently some of our water from the reclamation facility is going to other cities. Could you talk about that?
Yes, you call it de facto, but yes, you're right. Our discharge currently goes to the Canadian River, which ends up in Lake Eufaula, and the city of Eufaula uses that as their drinking water. If you've ever drank water in Oklahoma City, they have Woodward, El Reno, I believe Yukon, all discharged to that Canadian River that ends up in Overholser, Hefner, and then they treat that and people drink it. So that's the de facto approach, where you don't think about it, it just happens as it floats down a river to the next town. But as far as intended, the coasts, like in California, they do it, but then they'll inject it in underground and then pull it out from a different source, from a well, away, just to kind of give a natural barrier. And so Norman is kind of on the forefront. We'd be the first in Oklahoma to do this. Wichita Falls in Texas did it when we had a drought back in 2011, and it was because they ran out of water. And but they ended up going with a direct potable reuse. And then also there's one in Big Springs, Texas. They have the setup to be able to do a direct potable reuse or indirect potable reuse. So yeah, but we want to look into it and just see it's instead of letting that water go and be for other communities to use, how clean would we need to get it so we all feel comfortable that it's a good water source for us to use right here in our own watershed. So
great. So I just wanted to make sure that we all understand that this is nothing new. We're not inventing something here. We're just building onto something that's already being done across the US. And this is a great way to ensure that we don't run out of water. So
that's
thank
right.
you, Chris.
It's drought proof. That's right. Our wastewater flows 11 million gallons a day every day. So it would be a nice source to utilize if we can get it clean enough to feel comfortable with it. So
thanks.
Go ahead. Oh, Councilmember Nash, I'm sorry.
Is it possible to reclaim enough water to sell back or sell up to more?
Yeah, maybe, but I think The first thing is I'm going to be bringing you guys more information coming. I have a meeting next week with the COMCD, and they're going to rediscuss our firm yield of the lake and let us know. It sounds like they're going to tell us that it's not as much water as we think we've had. And we've been overutilizing our allocation since the late 90s. Norman has overutilized the lake. So I think the first thing we're going to want to do with it is shore up our supply at the lake. And we need to share that with Del City and US City, since they share that lake with us, and get them comfortable that it's a good idea of how it's going to help them secure up the water supply. Right now, they have been keen on us putting water in the lake like that. So they're looking over our shoulders and going to watch this pilot project very closely. And hopefully we'll bring them along to show them that it's an asset and a benefit if we can get this pulled off. So.
Thank you.
Okay, Kim, I think you can go ahead.
Okay, moving on to water reclamation. Water reclamation facility, the plant performance average flow is 11.5 million gallons per day. These statistics here just show that the facility is meeting or exceeding their permit limits. Sewer line maintenance maintains over 500 miles of sewer lines. There's a question.
Councilor Patron.
Okay, Mr. Mattingly, I can't help but, I mean, that the screen just spoke to E. coli. There's an elephant in the living room. Can you speak to what happened and tell us?
Yeah, I wish I had the smoking gun, but after our crews flushed so good to get rid of it really fast, then we could not find another hit of it to know exactly where it came from. So that, if it's not beyond a doubt, I had to make sure it's not. First, we checked every well source, make sure one of the wells didn't flood. I had to make sure, do we have any line breaks? Sometimes you can have a line break and the water can contaminate from natural water. We might have someone that made a connection to us that I don't know about, that had their hose in a pond or a lake, filling it up, and then it back siphoned one of our line breaks. So we've really been going through extensive sampling and trying to find something to say what exactly happened. And then obvious is, let me tell you the obvious, we have a contractor installing our well lines out in the very far northeast, about 108th and Franklin. And they were actually doing disinfection of those lines because they were dirty. They just put them together. So they could have had animal crawling out of the pipes. That's normal. And then usually super chlorinate it and get it all safe for 2 days. And then we open valves to let it go through our system. Our guys always control those valves to make sure they don't back siphon or come into our system before it's all disinfected and proven. But everyone says no one touched a valve. I mean, we've gone thoroughly through all that. There was one part out on 84th and Franklin. We saw, after we did get all the chlorinated water in, we saw a little bit of a reduction in chlorine, which tattle tells that something was using that chlorine possibly. So we super chlorinated that section of lines to make sure it was good. So anyway, we have it under control. Everything is clean, safe. The crews did great and actually had it all clean and safe by that Saturday morning. And then we proved it on the Sunday following. But it showed a weakness in our system that we've known a long time. And DEQ has been asking us and Edmond, because we're the two big cities in the region that have well water that goes to town without chlorine in it. And a lot of people have a hard time understanding that, but let me say it again. Well water pumps in and it goes to town without any chlorine in it. And it's been safe for all these years. We've been able to pull it off. But DEQ's always said that bothers us because you're using a surface water supply also, and it's supposed to have chlorine all throughout your system. And you have these areas where the well water might be blending with that and you have no chlorine residual in that area, and that makes them nervous. And we've been able to, we're be to the rules and everything up to this date, but they said, we want you guys to start chlorinating and having a chlorine residual throughout your system. So this was already teed up. That was going to be our next rate increase. It was teed up last year, actually, and it's going to take about $16 million for us to bring all the well lines together, set up a disinfection point so that we can add chlorine and ammonia and have that as a residual in your system. And that's good insurance in case something like this were to happen. The bacteria can't sit there and grow. It, in a water that has no chlorine in it, it's very happy. So if we can have that ability to add chlorine and ammonia in there and have that residual, that's our insurance that things like this won't happen again. So not as likely. So I feel DEQ is going to really put the pressure on us, which I think they should. And I think all of us need to understand we need to do this. We've been wanting to do it for a while, just knew it was expensive. And then the other added bonus it's going to get us is once we get the wells to one spot, one piece of land, that'll give us the ability to set up treatment trains. Because another one we all talk about every once in a while too is the chromium. If we want to reduce the chromium numbers in town for the well water, if we can get it all to one spot, we've done pilot projects and we know how to remove chromium from the water, but we have to have it all in one spot so we can set up a treatment train for that. Or if arsenic numbers go lower and we want to go lower on arsenic, then we can treat for arsenic. Again, it'll set us up for treatment. It gets us disinfection. It's just the right move that we have to do for our water system. So I'll be bringing that forward in the rate increase. And that was already teed up. Ken had already started that last summer. That's what we were going to bring forward. So.
Okay. I can't see all of the other council members' faces right now. I'm sure that Councilmember Foreman, since her ward, I can't see her, but I assume she has some questions. But I guess my question right away would be, how often do you test it such that we learned it? How long had water been flowing through before we knew?
On Wednesday, we had good tests in that area just by circumstance, by chance, because we take like 90 samples throughout our system every month just for DEQ compliance sampling. So we had a bunch of samples over by the hospital, over by Highway 77. They were all good. The 6 bad samples that came in were predominantly way out by 108th and Franklin. There was one by 84th and Franklin, and then it came up. There was one bad one around about 24th and Tecumseh, and that's what really scared our staff. And when they saw that Friday morning that the sample was not looking good, they didn't know if it was E. coli positive or not. They just thought it was bacteria positive. That's when they turned off all the wells, because that pushes that water from the well field, which there aren't many customers out there, pushes it into town. And they immediately turned off the well field and began flushing backwards to the northeast out of fire hydrants to get rid of that water, because we know well water is not, without chlorine in it, it is one of our weak points. So they did a great job on flipping it and getting it out of here. And we caught samples that Friday morning, which it takes 18 hours you have to set the water up for 18 hours to see if something grows, the bacteria. And so by Saturday morning, about 8 o'clock, we could tell they were clean samples. And then they were official probably about by noon. So, and then we were sharing that with DEQ. And the other thing we had to check too, DEQ said it might be a sampling error, lab error. We had to disprove all those, and we really didn't disprove them, but we did have DEQ take duplicate samples and make sure that it wasn't our lab. We were all getting the same numbers, same readings. And so since Friday, we all got clean samples all the way through, and even until today. So, and the other thing we did is once we push that chlorinated water out there, this is another great thing about having chlorine residual in your water, is you can go out and look at your water, and if it has a chlorine residual in it, it's good. It's like your swimming pool. And so those are quick tests that you can do with the little pink indicator. Again, doing a back T takes 18 hours. So if we can get to where we have chlorination throughout our system, that's also a quicker indicator for our crews to know, I might have a problem over here. I got a 0.5 residual on chlorine. They would say, we might need to check into this area. So it'll help us manage our system better as we move forward in the future.
So just so I understand, that the original test showed up Wednesday, and what was the test?
No, Wednesday, all good. It was Friday morning was our first official bad tests.
So somewhere between Wednesday and Friday is when it happened.
Yes.
Okay, thank you. I'm going to pass it on. I'm sure other council members have a question.
Okay.
Councilmember Holman?
Thank you. I would also mention, that the 2060 strategic water supply plan does call for a groundwater treatment plant, I guess you could call it, due to the issues that exist naturally and for the most part in the Garber-Wellington aquifer, which supplies much of the metro area with groundwater. So there are some naturally occurring elements in that aquifer that are problematic if not treated. And we've seen that with arsenic and chromium issues in the past. So I just wanted to mention that part about the strategic water supply plan, that this was something that we had talked about and was put in the plan to have the city staff plan for in the future, so we could treat those wells, the existing wells and the new ones, and even look at some of the old wells that have been shut off. Because I would mention that, with arsenic, the way I understand the history is the EPA lowered the limit back in 2006, and that caused many wells to go offline because they could no longer meet the new limit. So it was not a spike in arsenic, it was a lowering of the limit. New ones couldn't meet it and they were shut off. So having a central treatment facility or process for the well water could be very beneficial to the residents of Norman and going into the future. So I definitely have supported that project and still do, and glad to see it moving forward. I do want to give a quick shout out to my buddy in the picture here, David Perez. Went to middle school and high school with David. And so he's a local guy that grew up and now works in our water reclamation facility. So just to give you an idea of the type of people we have working in those places, we have people that really care about Norman, their families live here and drink the water and use the reclamation facility as well. So we really have great people that care dearly about the safety and health of the residents that they're serving. So just want to mention that. Thanks.
No, that's a good point. I'm going to add one piece of that. The well field is 30% of our supply, of our water supply. And that's exactly what the 2060 strategic water supply plan said, is we need to secure that. So we need to set up and be able to treat that if and when limits continue to go lower, which they will, and be able then to treat and keep that as part of your water portfolio. So good point.
Okay, I think you can go ahead, Kim.
So sewer line maintenance maintains over 500 miles of sewer lines, almost 12,000 manholes. They clean over 1.4 million feet of sewer lines each year. They inspect and record over 250,000 feet of sewer lines. And over the last 20 years, they've reduced the sanitary sewer overflows by 90%. So this is probably my favorite rate comparison, because there's only one city on here that has lower water reclamation or sewer rates than Norman does. We haven't had a rate increase since 2013 for 10,000 gallons. The average here is, let me see, $56 a month between these benchmark cities, and Norman's sewer rate for 10,000 gallons is only $32 a month. So we're 42% below the average for our sewer billings.
Yep, and I'm going to add right here, again, we were talking about earlier, sanitation rates were good. That rate is good. The water reclamation, it's close, but I think it'll go another 4 or 5 years. Water, we're in trouble. So that's my final statements on that. So
the question.
Councilmember Peacock.
Yeah, I'm just curious what a water rate increase would go to funds, if you could point out some specific examples.
yeah, we have it lined up. It's about 16 million for that disinfection plant. And so the loan payments on that, we figured about a 1.7 million a year to fund that. And then the other one is the AMI. Right now we're at a point where we probably need more meter readers. And this is where you go to automated reading, where we already have water towers. You can shoot everyone's meter. Also, it gives you an opportunity to go replace everyone's meter to start. We don't replace meters often enough. And it's that's your cash register of how well you're running your operation. Another thing it'll give you is currently we only read it on the month. And so if they had a leak and that was being wasted, it was going down the sewer, you don't know about it for 30 to maybe 60 days later, they bring you a plumbing bill. So we lose a lot of water just because we're not quick to find out about it or measure it. And so this would give us the ability to measure a lot quicker. It'll be customer friendly. The customers will be able to know more, use your iPhone to see what your water usage is. And then we could give them notices when we see a toilet leaking or something going on, a line break. It's got a lot of plus sides. I mean, it's where everything is going, and it's automation, and it's 14 million, and the loan payment on it's like 1.7 is what we figured. And then the other thing is, she showed that line going across Robinson. That's a main artery, a 30-inch going from the water plant over to the Brookhaven water tower. And that one has, if you guys have been here a while, it's blown up. The line has busted in front of Westwood Golf Course. It busted in front of Target. I think it busted on the west side of I-35. We were worried it was going to bust under I-35 and wash out the traffic. And our line maintenance guys tell us, hey guys, we got to get these fixed. And we're trying, but we seem to always be a little late because our funding, you saw each of those sections, we do it in phases because that's all we can afford, about 3 million at a time. But that we're hoping, like sewer maintenance, when we, in 2001, 2002, they did the $5 extra for the sewer maintenance plan. That gives us $3 million just for replacing sewer lines that are leaking. And so that's been an awesome funding source. So we're going to ask for something, maybe not get that big of one, but look at something for water to really try to replace water pipes across town to try to keep up a little better than we're doing now. So.
Awesome. And so to accomplish most of that, where do you think we would need to increase our rates to?
I'm going to bring that to you guys because you can, as a finance person, I mean, you'd want to put it, if you want to guarantee you get the money, you put it in the base rate. That way you get it whether you sell water or not. But that hurts people on fixed income, lower income. So you got to balance it. So instead of, you can't put it all there. That's not fair. So a lot of times you want to put it on the higher users, those that have plenty, want to use a lot of water. Well, then you're going to pay a little more and you'll help us pay for some of this infrastructure. So that'll be a balancing act that we'll all try to tackle together and try to do our best job of painting in the middle so it's fair to everyone across the board and not just beating up on one category that uses the water. But
no, I really appreciate that approach. Thanks.
Yeah.
And then here again, these are some projects that have already been delayed for funding, and more will come up.
I appreciate you guys clarifying that.
Okay, so back to water reclamation, major revenue assumptions. Residential wastewater service rates were raised in November of 2013, and our current rates are $5 base plus $2.70 per 1,000 gallons of treated wastewater. User fee revenues for fiscal year ending 22 are budgeted at a projected 2% increase from the fiscal year 21 estimate. Estimated fiscal year ending 21 ending fund balance for the water reclamation fund is $892,000. The projected ending fund balance for fiscal year ending 22 is $45,919. Expenditure assumptions. Major projects for fiscal year ending 21 carried into fiscal year ending 22 are the centrifuge replacement project, $3 million. The reuse pilot study project at $3.1 million. And then major projects deferred to fiscal year 23. Line maintenance building, we saw earlier in the water fund. The storage building, $1.1 million. And the main control building renovation with laboratory, $3.5 million total project. Chris, did you want to say anything about this reuse pilot study?
No, again, it's underway, and you can see on the picture on the right, the two basins. that we repurposed for the pilot. We're testing two systems against each other to see which one can remove phosphorus and nitrogen the best. And then later this fall, we'll bring in some skids of treating advanced treatment like ozone and biofiltration and maybe some UV and hydrogen peroxide. Those are going to be things that will go after some of the contaminants of emerging concern, pharmaceuticals, other things that are really not monitored or limited by rules, but we'd want to try to see how low we could treat those as well if we're going to use it as our water source.
So on to one of the sub-funds of the Water Reclamation Fund, the Sewer Maintenance Fund. As Chris touched on earlier, all the revenue in this fund is from a $5 a month sewer maintenance rate. It was approved in 2001, and then there's a 50-cent per month capital improvement charge. All sewer maintenance rate projects are on a pay-as-you-go basis. So as we raise the money, then we'll fund the projects. Since 2001, over 433,000 feet of sewer line have been rehabilitated with the Sewer Maintenance Fund. Major projects in the Sewer Maintenance Fund in fiscal years ending 21 and 22, the Bishop Interceptor replacement, $2.6 million, with $900,000 from the Sewer Development Fund. Brookhaven Creek Interceptor at $500,000. SMP stands for Sewer Maintenance Project, $2.3 million. That's in construction. That's Sewer Maintenance Project 17, Sewer Maintenance Project 18, $2.9 million. And then Sewer Maintenance Project 19 is $2.6 million. I think this is a little small to make out in this diagram here. Chris, do you have anything to add to this?
No, but we just keep tackling older parts of town and repairing the lines. And I think we're now up to the 60s or 70s. We started with the oldest lines first. Looks like it's just north of Highway 9 and probably east of Atwoods a little bit. So that'll be our next one we tackle.
And there's a question.
Councilmember Holman.
Yes, on the maintenance fund. Maybe correct me if I don't recall correctly, but I think this was approved by voters in response to the overflows that you mentioned earlier that we've reduced by 90%. That there was a real problem, and there might have been a similar situation that we're in with stormwater right now, where we have orders to clean up the problem, and we've been unable to get voters to approve a funding source to do that. But from what I understand of the history of the Sewer Maintenance Fund, that there was a problem with sewer overflows, and that was part of the motivation that got voters to approve this $5 fee. So I would kind of encourage everyone to think about that going forward as we continue to discuss stormwater solutions. Thanks.
Yeah, that Councilmember Holman is exactly right. That was part of 2000 wastewater master plan, and there was a big citizens committee that met for several months that came up with solutions to those overflow problems that were talked about, and the moratorium on building that was put in place because of them. And there were really three solutions financially put in place. One was the sewer sales tax to fix the problems. It was a 5-year sales tax. And then there was the sewer excise tax that still is in existence for expansions to the system. And the sewer maintenance fund was in place basically to make sure that we didn't get back into those overflow situations in the future. So it was really a good plan, and we're still benefiting from it.
Thanks, Anthony.
Okay, Kim, go ahead.
So moving on to the second subfund of the Water Reclamation Fund, the New Development Excise Tax Fund, where revenue is from new construction building permits based on wastewater generated. And we are projecting a slight increase in fiscal year 22. The blue part of the bar is the residential revenue budget, and then the red part is the commercial. fiscal year ending 22 projected revenues of 1.4 million, and 1.1 million of that is from the residential projects, and 300,000 is from commercial projects. Projects for fiscal year ending 22 include the Summit Valley Interceptor, 207,000, with 360,000 from the Water Reclamation Fund. Bishop Interceptor replacement, 940,000, with 2.6 million sewer maintenance fund. Brookhaven Creek Interceptor, 500,000, with 500,000 sewer maintenance fund. And then the future Southeast Lift Station at 4.69 million. So this brings us to our final slide. This is a great picture. You can see here, this is for all utility rates with these comparison cities. And this does include stormwater fees for the, let me see, 13 of these 16 cities do have a stormwater fee, or a miscellaneous fee for something like street lights or mosquito spraying. There's only 3 of these 16 cities that does not have a drainage or stormwater or miscellaneous fee, and of course Norman is one of them. We do have the lowest total utility bill, and again, this is for 10,000 gallons of water usage and sewer usage, which Chris said represents about 80% of our customer base. So the extra billings for the stormwater or for streetlights, they range anywhere from $1.70 a month in these other cities to $13.48 a month. So I think this is a great comparison here. There's some questions.
Councilmember Holman.
Yeah, this is just another chart I really enjoy seeing every year, because we always hear comments about how expensive Norman is and how unfriendly Norman is to people wanting to move here. But this chart every year continues to show that Norman, when it comes to total utility rates, is significantly cheaper than all of our neighbors, even cities that are smaller than us, like Moore. Moore is over $20 more per month, or just about, than we are. And the next city to us is almost $20 more per month than we are. So I think that's really shows that our staff is able to make the most out of the resources we have, that we've asked voters for rate increases sparingly, only when needed. And, voters have been historically willing to approve them when we've been able to show, the evidence of what we've done and charts like this. So I would encourage all my colleagues to take a snapshot of this one and feel free to use it anytime the conversation comes up about how Norman measures up to other cities when it comes to cost of living. Thanks.
Councilmember Patron.
I brought this up several times in the past year about late fees for water bills. Can somebody tell me what the accounts receivable total is for late fees outstanding on water bills?
I don't have that information just readily at hand, Councilmember, but I'll get it to you and send it to you tomorrow.
Okay, I appreciate that. Thank you. The fact that it's not in these slides leads me to believe that it is not a receivable that we are relying on in order to make our budget for next year. Would that be correct, Mr. Mattingly?
I'm not sure of your question.
So if it was a number that was hugely important for us to make our budget next year within the water fund, I would assume that it would have been in the presentation as part of our, this is what we expect to receive and we're depending on it.
No, ma'am, our receivable schedule is very classic and similar to any other utility, but it is just part of the revenue base. So when the revenues that are receivable now are collected, they become revenues. So it's really just a revenue schedule that we base our budget on.
Okay, yeah, I agree with that on revenues. I'm talking about just late fees as a form of revenue.
But again, when someone pays their bill, if it had been a late bill, that becomes revenue. And it is the revenues that we base our budget on.
Let me just go ahead and put it this way. When it comes to fines and fees with other parts of our budget here in the city, we have had forgiveness times when we say basically it's unlikely that we're going to be able to collect certain fines, or maybe it's for the library and you say bring a canned food item and we're going to forgive the fee. I'm feeling like over the past year, when it comes to water late fees, it is not correlating with usage. In other words, they didn't use, of course you can hear my dog snoring again, because every time I talk, the dog's got a snore in the background. But anyway, when it comes to water fees, it's not something that they have used our product and then, and that's the part of the bill. No, it's a form of punishment for not being able to pay that bill timely enough. In other words, the bill stays the same for usage, and this is tacked on as punishment. And I am feeling like that for the past year, the working poor and the poor have really taken it on the nose with COVID, while the rest of everybody else have, and especially the people at the very top, have done remarkably well during COVID, unfortunately. And, you know, as far as that disparate impact. And I appreciated the progressive nature of the proposal that you were making and will be explaining to us later for how to potentially be raising rates and offering that to the voters. And I would really encourage this council, as well as the water department, if you guys can figure out a way that, because my understanding, we don't actually go after creditors and all of that anyway. This isn't something that is quote unquote enforceable. You can't, I mean, water is life. It's an absolute bottom line need. Every single human being has to have clean water. But this fee is just a punitive, you didn't have enough money to pay on time. So I would really encourage that we look into what we can do for the fees over the late fees over the last year and give some relief to some of these families. That's all I'm going to say on that soapbox, and I hope that other council members can agree with that.
There's no other questions.
That concludes the presentation. If there are any other general questions on this.
I'm seeing none.
I have a quick question for Chris, which has nothing to do with the presentation. But as a former chemist, how big is the centrifuge? Just out of curiosity. The diameter.
Yeah, probably 2 or 3 feet in diameter, I believe. Nathan, is that about right? Nathan's on here.
Yeah, I was gonna say it's about 8 feet long and then 2 or 3 feet wide. I think you've got it about right.
Yeah, it's a fast spinning, just spins the water out like a spin cycle out of the sludge to dewater it. So we don't haul, you know, it's expensive to haul water to the wherever you're hauling it to. So you try to get all the water out and only haul the dry or the solids. But we're also looking into some different types. That one spins so fast that it seems like it's wearing out the bearings a lot. And so we're looking at a slower spinning ones that are some screw presses and some other technologies that might compete equally, maybe not as good, but cheaper and maybe better to operate and maintain. So
Thank you for humoring my nerdy question.
Any other questions, nerdy or otherwise, as long as they're related to enterprise funds? Seeing none. All right, team, good work tonight.